Good afternoon and hello and welcome to 72 Dragons. It's a pleasure to have you here, Dr. Silva. My name is Rahul. I'm one of the writers for 72 Dragons, and we are a production company based in Hong Kong. And today we also have Dr. Pietro Aparicio. He's the Chief Operating Officer of 72 Dragons.
Great. So welcome, Dr. Angelica Silva. It's really a pleasure to have you with us. Dr. Angelica Silva is a public health researcher at the Oswaldo Cruz Foundation in Rio de Janeiro, Brazil, and a partner of Zero Mother's Day. Thank you, Dr. Silva, for sharing your knowledge and expertise with our audience today. You are a public health researcher and have a PhD in public health. Please share with our audience what is the role of public health research and its relevance when it comes to people's health, particularly in the context of Brazil.
Public health is a field of practice and knowledge. It embraces the social sciences and biomedical area to improve and achieve the quality of life for population of a territory. And our actions are generally with a qualitative vision. We intended to be transdisciplinary to give the best and holistic care to anyone. In this vision, every professional has an ethical commitment to cure and to care, from the physician to the web designer of a health institution, for example. So in our National School of Public Health in Brazil, we have nurses, psychologists, engineers, and even journalists like me, learning and teaching how to take public health issues. And these issues are how people live, how people born and die, and can the life cycle be better? Is the happiness a possibility? These issues.
Great. It's fantastic to see that you're also a journalist, so a public health researcher and also a journalist. That's great.
Since you are connected to public health research, can you talk a little bit about Oswaldo Cruz Foundation in Rio de Janeiro? And what do they do? What kind of projects do they work on? And where does the foundation stand in the world of local and international public health?
Brazil, as you know, is a low and middle income country. And with 200 million people living with many inequities. We are the second most uneven country in Latin America, according to the World Inequality Report 2022. Fiocruz, Oswaldo Cruz Foundation, is a health public research institution that was born in this context more than 100 years ago, with a strong link with Pasteur Institute in France. Because of that, we produce vaccines and drugs looking at the public policies which will decrease the gap between the most poor and the rich people here. These actions are allied to research ways to guarantee the sanitary conditions, the sustainable development, one health for humans and environment, and a global citizenship for all the living in different biomes. That's why we have some hospitals and technical scientific units spread in Brazilian territory. That is a continental country, as you know. And in African countries, either we have units. So we have international partnerships, including India, in health research to improve life. Today, our attention is turned to the United Nations 2023 Agenda of Sustainable Development Objectives. We think that the planet is sick.
It sounds like the Oswaldo Cruz Foundation is really a very important work, not just in Brazil, but also internationally. Now, you come from a public health research background, have been involved with Millennia 2025, and are a partner with Zero Mothers Die. How did this partnership begin? How does public health research connect to Zero Mothers Die? And what are the benefits of this partnership?
I came from a public health background. My thesis was about how telehealth and healthcare services are in Brazil. Nowadays, telehealth is known as digital health. And my employment, when I met Veronique, was in the National Institute of Women and Children and Adolescents Health in Fernandes Figueira, one of the units of Fiocruz. I was creating a telehealth laboratory in the maternity hospital, and I met Veronique in an annual meeting of an International Society of Telemedicine and E-Health in Luxembourg. I think the year was 2017. I think so. And we have known each other in another feminist scientific meeting in Panama City years ago. And she told me about this project to help women not to die, giving birth, using mobile phones. And I said to her, let's bring it to Brazil. I am working with midwives and obstetricians and staff in a national institute. Let's work together and make cultural adaptation to Brazilian people. The maternal mortality in my country is a serious problem. In Europe in 2021, 13 women died in 100,000 births. In Brazil, 107 women died in birth. It's a very high rate comparing to European rate. And COVID-19 was responsible for more than 1,500 deaths in 2021. But the leading causes of maternal mortality are evitable, such as hypertension, infection, and hemorrhage, especially in postpartum. Our staff in maternal hospital of Fiocruz did the cultural adaptation of the app to combat this problem. And we asked 100 pregnant women and mothers of new babies if Zero Mothers Die, translated by the researchers and health professionals of Fiocruz, would help them to reach quality of life during pregnancy. They approved our translation, and so it was not a cultural adaptation with the traditional steps registered in literature. We asked the women about the importance of a mobile app in their lives.
We can see how maternal mortality is an issue in Brazil as in other countries. Thank you for sharing that.
Dr. Silva, I wanted to focus and come back to Millennia 2025 and Zero Mothers Die. We wanted to focus on women's health. And obviously, these two foundations, they do focus on women's health, maternity health, and prevention of maternal mortality. So can you tell us about Brazil and the communities you worked with, and what is the current situation in Brazil, and how this partnership of Zero Mothers Die and Millennia 2025 will is impacting the result of your work?
Well, like I said, there is many people living in locals that I named health inequity concentrating territories in our big cities. I think there is some locals like that. These locals are named here as favelas. They don't have the state present and are governed by a violent mafia that we call here militia. There are many poor people living in favelas without fresh water, with insalubrity conditions, and paying taxes to these criminal organizations. Sometimes only the public school or the primary health public services are there helping the population, and we are intervening in this complex situation. But there are other situations that we deal with in rural areas. The agribusiness here is monoculture and extensive. The landowner removed the original people by force and assassination. And these people, indigenous or quilombolas, black people that was slave in the past, who lives in forests in these areas, have often only the health professionals of our public health care system, named SUS, to assist them. The SUS is a very important instrument to these groups that I said, because it's a universal healthcare service from his conception.
Thank you for bringing up the favelas in the indigenous community. I think those are very vulnerable groups, not just in Brazil, but in other communities. And also you mentioned the Mobile Act application that Zero Mothers Died is using all over the world. So maternal health and achieving Zero Mothers Die is a gigantic task and goal. What future interventions and projects are your partnership with Zero Mothers Die planning to engage to achieve this goal, specifically for Brazil?
Everyone in Brazil has a smartphone, indigenous and poor people, and we are planning to do a personalized help to mothers in poor situation, dealing with tropical neglected diseases, more specifically dengue, chikungunya, Zika, and COVID-19. The first three diseases has the same vector, the mosquito, and we have constructed a chatterbot, and we will integrate to it to Zero Mother Dies app. And we think that we can assist the African Portuguese-speaking countries because they have the same problems. They have the same climate and have the same problems. And other thing that we are planning to do is a course to health professionals in the app, improving the vigilance of maternal mortality. There are many factors in Brazil linking to gender violence, like an atypical number of cesarean operation to cut the women, not a natural birth, but to cut the women, and wrong obstetric practices. Well, many things to do, and many women and babies to help.
That's great. Really sounds like, there's still a lot of work to do in achieving Zero Mothers Died. And it's great to see that the application is working and you also using this application to address other health issues in Brazil.
Certainly, I agree with Dr. Pietro. Well, this brings us to the end of our interview session, and it was amazing having you here, and it has been a great pleasure talking to you. Dr. Pietro, would you like to add something here?
Sure. Dr. Silva, it has been an honor, really, and a privilege talking to you about the incredible work that Zero Mothers Die is doing, particularly in Brazil, to ensure that every mother has a successful pregnancy and avoid so many preventable deaths. So thank you so much for your time today.
Okay, it was a honor to me too, and I hope to see the results of the program and help Zero Mothers Die.
Wonderful. Thank you very much, Dr. Silva.